there's a fundamental difference between how the Republicans and I think about Medicare and Medicaid in our health care system. Their basic theory is that if we just turn Medicare into a voucher program and turn Medicaid into block grant programs, then now you, a Medicare recipient, will go out and you'll shop for the best insurance that you've got, that you can find, and that you're going to control costs because you're going to say to the insurance company, this is all I can afford. That will control costs, except if you get sick and the policy that you bought doesn't cover what you've got. Then either you're going to mortgage your house or you're going to go to the emergency room, in which case I, who do have insurance, are going to have to pay for it indirectly because the hospital is going to have uncompensated care. So they don't really want to make the healthcare system more efficient and cheaper. What they want to do is to push the costs of healthcare inflation onto you. And then you'll be on your own trying to figure out in the marketplace how to make healthcare cheaper. The problem is you're just one person. Now, you work at Facebook. It's a big enough company. Facebook can probably negotiate with insurance companies and providers to get you a pretty good deal. But if you're a startup company, or if you're an entrepreneur out there in the back of your garage, good luck trying to get insurance on your own. You can't do it. If you're somebody who's older and has a pre-existing condition, insurance companies won't take you. So what we've said is, let's make sure instead of just pushing the costs off onto people who individually are not going to have any negotiating power or ability to change how providers operate or how hospitals or doctors operate, how insurance companies operate, let's make sure that we have a system, both for Medicare but also for people who currently don't have health insurance, where they can be part of a big pool, they can negotiate for changes in how the healthcare system works so that it's more efficient, so that it's more effective, so that you get better care, so that we have fewer infection rates, for example, in hospitals, so there are fewer readmission rates, so that we're caring for the chronically ill more effectively, so that there are fewer unnecessary tests. That's how you save money. The government will save money, but you'll also save money. So we think that's a better way of doing it. Now what they'll say is, well, you know what, that'll never work because it's government imposed and it's bureaucracy and it's a government takeover and they're death panels, and I still don't entirely understand the whole death panel concept. But I guess what they're saying is somehow some remote bureaucrat will be deciding your health care for you. All we're saying is if we've got health care experts, doctors and nurses and consumers who are helping to design how Medicare works more intelligently, then we don't have to radically change Medicare. So, yes, I think it's fair to say that their vision is radical. No, I don't think it's particularly courageous, because the last point I'll make is this. Nothing is easier than solving a problem on the backs of people who are poor or people who are powerless or don't have lobbyists or don't have clout. I don't think that's particularly courageous.